Hey there, my name is Kenny Dennis, and I'm a licensed professional counselor and trauma therapist in Monument, Colorado. As a trauma therapist during these difficult times, I've been increasingly concerned with the overall impact stress and trauma is having on all of us. This is especially true for those working in the first responder and medical fields. And while these videos are intended to help everyone better manage stress and trauma, our hope is that those on the front line will have tools to stay as healthy and connected as possible. As the impact of the virus becomes more prevalent, we will all need to address our trauma and grief. My guess is the need for trauma processing will likely exceed the number of trained therapists available to assist. And even if there were enough therapists, few will have the time or resources for a traditional therapy appointment. With that in mind, this brief series of videos on self-care with EMDR has two goals. The first is to give you all the tools you need to be able to use EMDR on your own to relieve stress and trauma. While you may not get a sense of full resolution during this stressful time, a helpful expectation is to reduce your anxiety and stress in ways that will help you stay connected to yourself and others. The second goal is to help you better understand the EMDR process, especially in an online delivery model. If you find you need the help of a trained therapist, understanding these steps and having the tools for identifying and processing targets should help you find a competent therapist. So what exactly is EMDR and how does it help? EMDR stands for eye movement, desensitization, and reprocessing. It was discovered and developed by Francine Shapiro. The most important element of EMDR is using some form of bilateral stimulation that engages both sides of our brain. Originally, eye movement was the primary method for this form of bilateral stimulation. Shapiro discovered that this can lead to reducing intensity or desensitizing our body's reactions, emotions, thoughts, and urges. As these parts of us are calmed, we're able to begin to reprocess the ways we think and believe about ourselves and our current situations. Francine Shapiro has become an advocate of self-care with EMDR and released a book on how to practice EMDR on your own. The book is called Getting Past Your Past. While the book contains tons of valuable information on EMDR, we're abbreviating some of these steps to encourage self-care and relief during these times. It may be helpful to remember that while EMDR has become the standard for trauma, it was originally developed to help reduce stress and anxiety. EMDR is an 8-phased, step-by-step process that essentially provides a framework for releasing stress and trauma. Adapting this process for telehealth to address the current crisis consolidates some of these steps. If you need more detailed information on any of these steps, there's a complete trauma course that details everything that's on our website. As a first step, EMDR therapists typically take a history of the problem. This is followed closely by a preparation phase that provides you with tools to help you remain calm and present as you process trauma and anxiety. To help shorten this step, we've pre-recorded some guided imagery and relaxation exercises, as well as some scripts and worksheets to help you find ways to remain calm and in the present moment during and after the desensitization phase. So before we can begin the actual processing steps, we need to have some tools for processing with EMDR. In our next video, we're going to take a look at different tools you can use to practice EMDR at home. Then, we'll dive into processing with EMDR.